They are some of our most vulnerable.
If a doctor or a hospital is using restraint simply for convenience or to coerce clients, that's abuse.
Patients unable to speak for themselves.
There are other ways to manage clients or residents that don't involve having to restrain people.
And experts say no one is taking action.
It's a failure of the policy and procedure.
Of the 4 licensed psychiatric hospitals with the most violations in Arizona, data reveals one more troublesome than all others. At the Tucson Medical Center's Palo Verde Behavioral Health Unit, Citations reveal concerning details, including handcuffing patients during transport. One patient suffered from a fracture while being restrained. And records did not contain documentation of restraint.
They're required by law to fully document the restraint.
Asim Varma, staff attorney for the Arizona Center for Disability Law, says the lack of documentation was concerning.
If that's not documented, that could be a red flag that maybe there was some abuse going on.
The Arizona Department of Health Services estimates that more than 200,000 Arizonans were registered as mental health patients in 2012. Almost a quarter of those patients in Pima County. The Tucson Medical Center has one of the highest numbers of license citations in the state. State and federal surveys cited TMC a combined 44 violations over the past 3 years. 80% of those happened in the 48-bed unit of Palo Verde Mental Health Services. Katie Mykleseth encouraged looking at the descriptions to understand the severity.
It's the content and it's what was their failure.
Lisa Samsel, a clinical administrator at the Foundation for Senior Living, a nonprofit that focuses on the care of the disabled and elderly, stresses the need for care over control.
You think of them as only their diagnoses, and when you get into the field, you remember, oh right, person first.
Under the administration of TMC, the Palo Verde Mental Health Services Unit was cited for issues of patient restraint and seclusion. When sitting down with Mykleseth, Newswatch asked why no action has been taken.
We do not look at the number of violations as a measure of quality or disquality. What is more important to us is a violation that has occurred on a repeat survey.
This is not the first time TMC has been in the news. In 2007, the Tucson Citizen found that TMC had been fined for its 13 restraint violations at its behavioral health unit. We called and emailed the Tucson Medical Center several times. TMC declined to comment due to a recent change in ownership. A change in ownership that has advocates hopeful for a change in care.
I think you either fall in love with this population or you shouldn't be working with them.